My name's Ed Christopher. I'm calling myself an independent transportation planning consultant. Quick background, 20 years at the MPO in Chicago. Sorry, it's an acronym. Another 15 years with the federal government, 2 actually with the Bureau of Transportation Statistics. I've grown up in the data world, but for the last 5 years, I've been co-chair of a subcommittee within the Transportation Research Board that deals with health and transportation. So what I'm doing is I work across a whole bunch of disciplines now, and I'm meeting a whole bunch of new people and actually learning a whole new vocabulary. And in some of the conversations I've had around here, I've realized everybody in this room doesn't know each other. And there's kind of some bridge building going on, and there's different disciplines here. So one of the things I want to mention is TRB committees, one of their main functions is to advance research and advance the state of the practice. And the way we do this is we write research proposals and we put out calls for research papers. And one of the things in a transportation field that's going to be totally different if you're coming from the health field, when we talk about research, it's applied. When the health people talk about research, the transportation people are like, what are you talking about? We'll never get to that. So there's that big chasm that I'm dealing with in my subcommittee. And I'm hitting on the TRB side of things and the committee's side of things and the calls for papers and research problem statements, because I think a lot of the stuff that we're talking about here, we don't have yes and no answers to. We don't have rules of thumb. And I think it's that structure that can really help advance some of these things. And I thought I was going to be able to stand up here with some great news today to share. We had turned in a research synthesis statement called Identifying the Health Costs and Health Benefits of Transportation Investments. Parenthetical, what do we know about the costs and benefits, and what do we need to know? It was not selected. Just a synthesis. I bring that up to let you know that it is a hard row to toe here trying to get support and get these through selection processes. And we're dealing on the transportation side with some industries that are pretty anchored into their same old way of doing things. And what we're talking about in this room is pretty different. And I'm trying to circle my way to this whole return on investment thing. When I was asked by people, my wife is a transit service planner, consultant now. She knows I do, she calls it this health stuff, not you people, fortunately. But when I told her I was going to this, she was like, well, what is it? Well, I read the title of this whole session to her, and she's like, well, okay, what is it? I said, okay, we're going to talk about the return on investment for providing and taking people to medical appointments and whatnot. And she says, return on investment, that's an accounting term. You're not really talking about that, are you? And you guys hit on this, and I'm gonna throw this kind of out to everybody. I'm wondering, when we talk about it and use terms return on investment, I know the VA, you mentioned it, and I was trying to wait for, okay, what are those metrics? Are we asking the right question? And it's been rattling around in my head, because coming from my research side, it's like, okay, the first thing I need to know is what's the question I want to answer? Let's try to articulate it, and then let me figure out how we can answer it. And then we start talking about the data we might need or the gaps and all that. But we also stay away from the data collectors at that point, because they tell you why you can't do something instead of helping you over that hurdle of what we want to do. So I'd like to hear you guys really address that a little bit deeper, if you can, as to what's the question we really need to answer, or let's put it another way, if you're going to deal with return on investment, your return on investment, I think, is different depending on what the goals of your organization are and what seat you're sitting in. And this is all going to relate back to, again, I think this whole thing spins up and got churned up because, face it, it's a lot of 5310, 5311, and other pots of public money in this, and Congress is putting the screws to everybody to justify, why are you doing this? Are we spending our money in the right place? And I think that might be one of our bigger questions, and Neil raised it. Besides, are we making people healthier? How do we know if we are putting our resources in the right place? And again, there's competition for resources and all of that. So, you know, I don't know if it's a rhetorical question, but, you know, I'd like to hear some of your insights on it. And you heard me talk about this when we did our prep call, too, so this was not a new topic.
Yeah, I loved that prep call, by the way, because you were saying the things that I was thinking. And after being here and listening to all the speakers, the discussants, I think we're all on the same page here, is that no one wants to see someone suffer because they don't have access to the healthcare that they want, because it doesn't meet, it doesn't hit the bottom line. The fact is that, as a society, we really should be prioritizing a healthier society where people get the treatments that they need. It's a moral issue, and I think someone brought it up yesterday. I forget who it was. If they're still here, say so. But said, what good is healthcare if you don't have access to it? It's completely useless. And it's an equity issue as well to say, well, you don't get treatment because you can't get there, and we're not going to provide that for you because that's, a public service that just doesn't fit in the structure that we've created for ourselves. I think we really need to take a step back and evaluate the fact that if someone can't get the transportation, it's really no fault of their own. They don't choose where the clinic is. They didn't choose to, have a chronic illness. These are things that we really need to step up and say, we live in a society where everyone should be equal. We live in a society where everyone should have the same access to healthcare, whether or not they were born, in an urban environment or with a chronic illness. And that's sort of the way I look at it. But addressing the question of what better way, how do we talk about ROI in a different way? What's the other question?
How do we justify our program to Congress is the one who's ultimately trying to justify it.
How do we justify our program to Congress? I would take the radical approach and say, maybe we need a new Congress. But sorry if I offend anyone there. But in all seriousness, we should justify it on moral terms. I don't think we should be justifying it in terms of monetary terms. I don't know how better to say that. Really, we need to make the case to our officials. We need to make the case to Congress, the one that we currently have, that this is a moral issue, that we shouldn't be denying people access to health care, period.
So my bachelor's is actually in business administration. So this healthcare term, return on investment for, what marginal unit of improvement do we get for this, individual widget is really tough to ascertain because it depends on the illness, it depends on the age, it depends on the income level. And so it's really this gray area. But, the ultimate question is, are we improving the quality of life? Are we reducing that cost of medicine that's not necessary or that could be proved in a more efficient manner? So, with Liberty, our goal is to expand the ecosystem of options. And so we may be starting out providing options to get to medical care, but that doesn't mean that individuals can't use that to go see their loved ones on the weekend, or they can't use that to take a taxi or take a Liberty ride home in a rural area instead of trying to drive your vehicle home from the local tavern and possibly driving home not safe in that manner. So, in terms of the most efficient option is really when you talk about proving this case to policymakers and legislators is saying, how can we provide transportation the most efficient way possible? Liberty drivers make 93 cents a mile. That's an incredibly efficient way to move people in a short amount of time. So, how do you justify it? It really depends on what care they need, but ultimately, you know, it depends on your stakeholders and what their goals are.
There's definitely room for more than one narrative. I'm actually a social worker by discipline, so quality of life is huge to me. And I think that's something that transportation is essential to. I mean, for people to get around, not just to healthcare, but to get around and do the things they need to do is so important. And I think that's a part of the narrative. And while a long-term study over a period of time, using the patient data that we may have and a quality of life scale could really demonstrate that, you know, especially if that transportation includes something beyond just medical care. But as far as return on investment business-wise, we need to identify those areas in healthcare that generate high cost. You know, the movement into a nursing home, the extended stay inside a hospital as an inpatient before discharge because there's no transportation. We need to identify those little pieces and measure the impact of transportation on those and demonstrate, look, we're actually saving you money. Yes, you're spending money for this transportation, but this is what we're saving you. And it will be a piecemeal approach, but enough of that could convince Congress that, wait a minute, this is a good plan. This is a good choice.
Okay, so we're going to have one more discussant, and as he comes up, I just have to take the moderator's privilege and make a comment too. So when, you know, because I'm involved in a couple of these ROI studies as well, and they tend to be in the world of social benefits. They're not necessarily in the world of clinical benefit. And so if you took a Medicare bill from people who had been in a long stay and you asked ROI compared to what, and you looked at all of the lab tests or all of diagnostics or all of the services and measured the ROI for each additional one, transportation might blow one of those or two of those or 10 of those out of the water. But in the absence of something else, it's really a false question. It's a necessary question because that's what people are listening to. But it's a shame we can't put it in the context of what else could you buy? If you weren't buying all that clinical care all the time, what else could you buy that's of value?